You're listening to The Social Workers on WCDB Albany.
Welcome to The Social Workers. You're listening to WCDB Albany. My name is Eric Hardiman, and I'm the co-host of The Social Workers here with Alyssa Lotmore. Welcome back, Alyssa.
Hey, Eric. It's Social Work Month, so I'm excited for that. Look forward
It
to
is
every March.
Every March is Social Work Month in the U.S., and that's exciting, right? That brings lots of activities, lots of awareness, lots of opportunities to talk about social work-related issues. Very exciting.
Well, the theme is social workers are essential this month, and that was put out by the NASW. But what's sort of exciting is because it's a end of a pandemic year, I think. I don't know how to word that one. It's hopefully the end, but there's still a lot of things virtual. So I've been able to participate in Social Work Month event things that are in California or in, Arizona and just different parts of the state and even like internationally because you're able to participate via Zoom or something that is virtual.
And it's a great theme because social workers are essential and they're part of the workforce, part of the fabric of healers that help, the situation when we're in a pandemic like this. Social workers play really critical roles, but a lot of times those roles are behind the scenes. And so folks don't always know what it is that social workers are doing, how they're contributing. So I'm really hopeful that March will be a month in which the rest of March will be a month in which, we can talk about that and sort of amplify the message of social work.
Well, one of the things I will miss is our annual Social Work Month event that we have at the School of Social Welfare here at the University at Albany. And that's usually when a lot of our alumni come back for a speaker. We have a little reception where people can just network and talk and get together. So instead, we're doing a virtual event this year, and it's part of the Katherine Breyer Lawson, our former dean's lecture series. And it will be held on Friday, March 19th, and it is titled White Supremacy, Psychological and Social Impacts in the U.S. And it's going to be presented by Dr. Joy DeGruy, and I'm really excited for that.
A very timely topic, too, with all that's been going on in the past 12 months in this country, to be talking about white supremacy, to be getting some of these maybe, topics that were formerly taboo or more difficult to talk about publicly. I think it's a really important time to acknowledge what's going on. And I'm excited about the lecture, and I hope folks will consider attending that virtually.
And it is free, open to everybody. You just need to register so you can get the Zoom link in advance. And you can find out more information on our website, www.albany.edu/SSW.
Great. So if you just tuned in, you're listening to The Social Workers. I'm Eric Hardiman, again, here with Alyssa Lotmore. We have an exciting show lined up for today. We've got what we're conceptualizing as a virtual panel. So we have a panel of 3 faculty members from the University at Albany School of Social Welfare. I have to admit I'm wearing 2 hats for this particular day. So I will be part interviewer and part panelist because I am also a faculty member. So I'll be one of the panelists. We also have Dr. Wonhyung Lee and Dr. Rizzo. So we're excited to have 3 faculty members from the School of Social Welfare talking about our work, I believe, right?
Yeah, and why social worker is essential. That's something I think that as our profession, one of the things we do on the radio show is we say social workers, we need to get out there. We need to share our voice. We need to be the media, engage the media. And I want to use this theme of Social Work Month and that social workers are essential to help, highlight our faculty and the work that they're doing in the community and how they are making an impact. So I'm really excited for this show. And thank you, Vicki and Wonhyung, for coming on today. And hopefully let's get started so we have enough time to get everything in.
Let's do it.
All right. So let's just jump in, and maybe, Vicki, we can start off with you. What are your areas of interest and background? Let's just get a little bit about, how you got into social work and, what you are focusing on.
So I got into social work. Well, I was a high school English teacher, and I was a coach for track and cross country. And I realized that what I really liked was helping students with some of the personal issues that they were dealing with. So I came back, got my MSW. My areas of interest are aging and health. I was a healthcare social worker at a local hospital for almost 9 years before I came back to the University at Albany to get my PhD. So my area of expertise really, even though my research focuses on aging and health, more broadly defined, it's on really articulating the value of social work and defining the roles of social workers in interventions. So I study interventions and look at what are the social workers actually doing and how does it contribute to outcomes like well-being, emergency department use, utilization of services. And because we have not done a very good job in the past of articulating exactly what we do. And it's very important because that's how we can make the case for being reimbursed for the services that we provide. So I've done this work in healthcare, primary care. I've worked in community-based organizations where we've looked at elder abuse interventions, also looked at caregiver interventions. So it's really looking at what are social workers actually doing on the ground? How are they documenting what they're doing? And how can we connect that to outcomes?
Great.
Well, it's much needed. Wonhyung, how about you?
I would just start with my background. I will say my academic background is social work and urban planning. And so I am very interested in the area where these two fields intersect. So I'm mostly very interested in community development and engagement processes and just the people and places dynamics. You know, when we imagine a place or a neighborhood, you know, when we think that, you know, I wish there's something different, something new here, you know, how do those processes work? You know, who's at the table? What's the dynamics? And after certain things get implemented, 10 years down the road, looking back, was it work? I'm very interested in those dynamics and processes. And so currently my research and teaching, both of them are mostly on macro side of the work, I would say. So I'm very interested in something at a community level.
And Eric, we'll switch this up. I'm not used to asking you questions.
It'll be an interesting shift for me as well. But I appreciate being included on the panel and, you know, being able to talk about my work a little bit. So my research area of interest, as broadly defined as possible, is mental health services. And so I historically have been trained and sort of specialized in mental health services research. And more specifically within that, I'm really most interested in what I call peer support services. So those are services that are provided by individuals who have the shared lived experience with each other. Whether it be two people who are both diagnosed with a serious mental illness, providing support to each other, whether it be two persons with a certain medical diagnosis sharing support with each other, or two veterans. And so the study that I'm working on right now is about veterans and looking at quality of life for veterans in the community. So even, you know, listening to Wonhyung a minute ago talk about communities and neighborhoods and those types of issues, I think the role that veterans play within communities is one that is fluid and changing. And I think hopefully, I'm hopeful that we will start to rethink in many communities how veterans are able to exist within communities, contribute to communities, how communities can benefit from the veterans that live in their communities, and ultimately have a situation where veterans are not quite as at risk for the social isolation that they often experience. So that's kind of becoming a new area in my research, is really looking at social isolation as a factor, particularly for veterans, but also for other populations. And I think it's really interesting now in this year, in our 2020-21, the pandemic year, so to speak, that social isolation is a phenomenon that everybody is experiencing. It's something that it's not just veterans, it's not just people who are physically isolated, but it's all of us. You know, we all have a different connection to those around us based on who we're interacting with. And so we know from the research that social isolation leads to negative outcomes. And it leads to people feeling less connected and less valued and less, just having less meaning in their lives. And so for veterans, that's a really particularly unique challenge. And so the work I'm doing is trying to kind of get to the bottom of that and figure out what veterans can do to support each other, to combat social isolation and to build community and to really provide support for the veteran community in a different way.
You know, one thing I loved listening to all three of you speak was when people think social work, it's such a broad field, and you each have talked about your own areas, and we're essential in so many different with so many different populations, and it just all comes together for how we all work in the interdisciplinary, ability to one affects the other, and what happens over here in this population, the work that we're doing affects another population, and how it all kind of connects and comes together, but with those same foundational skills of social work that we all have through our schooling and our education and experience. So one of my roles at the School of Social Welfare is I do a lot with news stories, and I always am trying to highlight what our faculty are doing. So I know all three of you, because I posted news stories about, contributions that you've been doing recently in the field that have gotten some media attention. So I'd like to talk a little bit about that. And maybe we can just, anyone can jump in, but I know, Vicki, you just received a grant. Wonhyung, you just had an award for the collaboration that you were doing with the Compass program. Eric, I know you've been on the news and sharing your work with veterans. So let's just get into some of that and share about some of these new contributions and things that are gaining some media attention.
Yeah. Maybe why don't you tell us about your award, Wonhyung, and let's start with that.
Sure. So yeah, I think that's my most current, up-to-date project that I can talk about. Eric, when you were talking about social isolation, I really resonated with that. And also, I think this project is really related to that too. The project itself is called Smart and Connected Communities. And it's collaboration between our school and also engineering school. And the initial idea was to connect, how to connect people who are looking for services, service informations, and people who have that information, and people who are serving the community. And, we're learning that oftentimes when we want to search services, for example, food pantries, affordable childcare, or even vaccine, what do? I think that oftentimes people just Google or Yelp. We're learning that we are just following the public, trying to search here and there, hop through the websites, call somewhere, wait in line, leave a voice message, wait for an answer. So the idea was to connect, make a better, stronger connections in the community. And so we are trying to learn from a lot of local human service organizations about their barriers in coordinating services. And also we're learning from people who are using services, different tools, different mobile apps, different websites to look for services. So I would say that's the gist of the project. And the hope is that we want to find a technology-based solution that can really facilitate the communication among the people. It could be peer-to-peer, it could be a service provider to service seeker, it could be among the volunteers. So we just want to strengthen the communication within the community.
And I'm so curious, just listening to you, Wonhyung, is there and this may be something that you don't necessarily have data on yet, but I'm curious to ask if you could project forward and think a little bit about the impact of the pandemic and how it might potentially impact the ways that communities deal with these, sort of information-seeking processes. Do you think it will be different following the pandemic?
I don't know how different it's. I'm sensing the waves of technology, or like people's awareness of the importance of technology. I think, if you don't have a tool, if you don't have an internet, I think automatically you feel so disconnected because of the COVID. So I think, where we get information, who we are connected to, even on the political realm, right? Where do you get your news? Who do you talk to, before, after election? So I think the divisions in the society have become amplified around the issue of access to technology to some degree. So I think what kind of tool you have, what kind of access you have, I think needs a bigger attention for sure after the COVID. Mm-hmm. And I think social workers are at the forefront of a lot of navigation in information and also technology, but I also see a lot of gap, for example, in funding, right? A lot of organizations don't have enough funding to build nice looking, strong websites for consumers, clients, and maybe not so much awareness around what kind of tools they have at work for telehealth, right? Telehealth and all that. So I think it's a really critical time for our field to bring stronger advocacy around stronger accessible technology and connecting people better.
Well, hopefully that's one thing that this pandemic will do, is show the need for, how many people have been struggling even to get vaccine appointments, or where do I find out the correct information? So hopefully this, a positive from the pandemic will be that things like this, what you're working on, will have more attention and realize the need for more funds to be directed to services like that can help connect people and make people have the technology so they can stay connected and informed. Now, Vicki, you're doing something a little bit different, but it's also about connection. And I know you received the Mother Cabrini grant, and talk to us a little bit about that and how it's helping to connect with more rural communities.
Well, so I would say that in some ways this relates to what Wonhyung is doing. So, my work really has been about most recently, last year when I was on the show, we talked about the National Academies of Science, Engineering, and Medicine report on integrating social needs care into healthcare. And certainly access to technology is a huge issue for many people in terms of as a social determinant of health. And we've seen that greatly with the pandemic. So since that report has come out, one of the areas was building a workforce that can address the social determinants of health. Not only address them, but identify them, assess them, and then make plans for how we can address them. And so the Mother Cabrini Health Foundation had a grant call for proposals this year. And so the objective is to partner. We haven't selected organizations yet, working on those collaborations, to partner with agencies that serve older adults who are in rural communities, but also agencies who do not currently have social workers on staff, who would like to have social work students who could work with them. And the main goal is to develop with these agencies that are involved an online training course for about the social determinants of health, how to assess the social determinants of health, and then how to address them. With staff at the agencies who aren't necessarily social workers and students working on this together. So it's really a first phase to provide the training. I, just published an article with some colleagues where this was done in a rural area in Wisconsin in a free health care clinic. where they did not have social workers on staff. And so I think workforce development is critically important. And part of that development is not only having students and agency staff who may not be social workers understand the social determinants of health and how social workers can address them. But then providing this training, which then will elevate the profession of social work in this area of social determinants of health, which has been my focus for probably the last 7 years. But this is just a different angle on it. I've mainly focused on, looking at interventions that already address it, but now it's expanding more into the workforce.
Another way to show social workers are essential. Eric, let's switch over to you.
Yeah, so I guess I'd like to highlight the project that I'm currently evaluating, which is the Joseph P. Dwyer Veterans Peer Support Program. And that's a program that some folks may have heard about. It's been around for a number of years in New York State. It has expanded every year, and it's just an incredible program. It's now in 25 counties around the state. And essentially, it's a program that is funded by the New York State Senate in partnership with the New York State Office of Mental Health. And it was initially funded as a suicide prevention program, but very quickly expanded outwards from that and is really more about providing quality peer support services, trying to, as I said, reduce social isolation, to build community for veterans, to improve their outcomes. So when we think about veterans around New York State, and really nationally, but particularly here in New York State, only about 30% of veterans actually are service connected, meaning that they use VHA or the Veterans Health Administration healthcare benefits. So that means there's a large majority of veterans who are not connected to services, who are really at risk of isolation, who are at risk of being misunderstood, and who are, out in the rural parts of New York, they may be staying at home and they may be having, getting worse and worse because they're not connected to other people and they don't have something to live for. They don't have a sense of purpose and a sense of meaning. To use the military language, they don't have a mission. And that's really important for veterans. And so these programs, by using a peer support model in these various counties, enable veterans to connect with other veterans who can then provide meaningful support in a non-clinical way. So rather than having a veteran go to the VA or go to a social worker or another healthcare provider, the veterans can talk to each other and can provide support to each other. And one of the things we're finding around the state is that when they do that, they often then find new pathways into traditional care. So the veterans who start to connect with peer support start to find more purpose, start to find more meaning, start to become less socially isolated, more hopeful, and more willing to then also go for medical care when they need it, or to go for mental health care if they need that from a provider. So there's this sort of multiplier effect that happens when peer support comes into the equation for veterans. And communities, as I said earlier, start to see the value of veterans. They start to, look at veterans not as individuals who are primarily characterized as vulnerable or as weak or as damaged, but start to see veterans as a source of strength, as a source of expertise, as people who can provide care to others, who have creative ideas, who are, infinitely creative and flexible. And I could go on talking about the strengths of veterans. So these programs have been really significant, have made a huge significant contribution to New York State in terms of preventing suicide, in terms of building community for veterans, in terms of preventing social isolation, just making New York State a more hospitable place for its veteran communities. And luckily, it's a bipartisan issue. It's something that appeals to everybody because veterans, come from all political persuasions, and it's not one side or the other, which is, I think, really important right now when we're looking at increases in polarization in our society. That, you know, veterans are a population that really can contribute quite a bit and have a lot to offer, but also there's some hidden pockets of need out there in the veteran community. And so I'm really excited to be highlighting the work of these programs and highlighting the really incredible things that are happening in the veteran community in New York State.
Well, it seems like all of you are very active. Even, you know, so many times during this pandemic, it seemed like people weren't able to do some of the work that they had been doing, but it seems like you guys have been able to push forward because the work is so essential and so needed. And I think the pandemic brought that to light even more so, with the isolation and the technology and the rural communities. So is there any other areas that you're working on or projects that you're working on, or is what you've just discussed been is the main focus right now? Are there other things that you might want to talk about today about where else you might be?
Well, so I've just started this project, you know, it came out of this National Academy's report with some of you know, there were 3 social workers on that panel for the report. Looking at a couple of things, there's a national survey of health attitudes that has a representative sample. And what we're really looking at, me and this group of colleagues, is, you know, how do people's beliefs, you know, the Robert Wood Johnson Foundation has this action framework. And the first one is that the community has a shared value about health. And so they have a series of questions that look at, you know, people's perceptions, beliefs about their community, how their community values health. So we're looking at that, and how do those beliefs then impact individuals' civic engagement, such as in voter participation, volunteer activities, doing other things in the community. And also thinking about kind of parallel to this is, when you're talking about the social determinants of health, who's asking the questions? Like when you're sitting with a client or patient in a hospital, who's asking the questions about the social determinants of health? Because clients say, why is the doctor asking me those questions? Because the doctor is clearly not going to be able to solve these problems. So kind of looking at, how can social workers, you know, how can we use what we know about the contributions of social workers, the value of social workers? How can we use that to make the argument that we are the right people to ask the questions? And then it may be with a group of people that we address the questions. You may involve community health workers, nurses, physicians, assistants, but who asks the question needs to make sense to the client.
It is true.
I was just going to say, I think that's a great point, Vicki, because, you know, I've started to talk to one of my classes about the notion of social workers as boundary spanners, and social work, the social work profession as being a profession that often exists on the boundaries of not necessarily competing, but of different segments, different domains within society, whether it be the healthcare system and the patient/family system, whether it be the community and government institutions with civic engagement. But that there is this notion that there are these boundaries and dividers, and that social workers often exist in a liminal state that allows them to see both sides of a situation and to partner with both sides and to build bridges where there were not formerly bridges. And I think that's part of maybe what you were getting at with the, or one aspect of what you were getting at in terms of civic engagement, and in terms of, you know, that may not be a place where we've traditionally thought of social work involvement, you know, but it really is in the future. And certainly I think post-pandemic, we're going to look at civic engagement differently, hopefully look at social work differently, hopefully look at communities differently in Wonhyung, and neighborhoods, you know, in Wonhyung's example, that all of these things are places where social workers can show a different path and can really bridge those boundaries and span those gaps. So I'm excited about that for the future.
Yeah, me too.
So since this is Social Work Month, I want to end our segment with tying it back into the theme, social workers are essential. So can each of you talk a little bit about the most essential thing that you think you want people to know about social work and in the area of your expertise? What is the most essential thing that you would want a social work student or someone in the community to know about your area of expertise? It's a tough one. Whoever might want to jump in first.
A great question.
I'll add something for me, because for as we do this radio show, one of the things that I would like to see is more social workers talking about the work that they're doing. I think our work is essential, and a lot of people in the public don't know that. They don't know that behind the scenes work that social workers are doing. Sometimes they just see these end results, or, oh, that process was so smooth. You know, that work in the hospital, they're working with veterans, or people signed up or were connected so easily, but they don't see sometimes the work that goes in from social workers. So I think we are essential, and that we have to share our voice more. And one of the ways people can do that is by, you know, going on podcasts, giving presentations, writing op-eds or opinion pieces, really being able to be the voice for our profession. And if more of us speak up and share that work, that's great work that we're doing, I feel we'll be able to let the public, people who might never have considered seeing or using a social worker, you know, individuals in the community, to really know what social work is, who we are, what we do, and what we advocate for. And I think that will be a really great thing to show how we are essential. So I bought you guys some time by answering my own question. So you guys jump in.
So piggybacking off of that, you know, I've spent the last 20 years, time flies, like really examining what exactly is it that social workers do in interventions, and then how does it impact outcomes. I started with, you know, aging interventions and how does it impact health outcomes and cost outcomes. And I think the most essential thing that I would say to social work students and that I would say to social workers is you need to clearly articulate your role. Like clearly articulate your role if you're like a private practitioner, clearly articulate your role if you work on a team in a hospital, clearly articulate your role if you're working in a community setting doing change or program development. And then you also have to be able to clearly document it. And you know what we learned from the last study we did, which used electronic health records, is we were able to really help the social workers clearly say what they did so that people didn't have to guess. If you're using motivational intervention interviewing techniques, you need to say that you are using them. If there should be no guessing. The doctor should know that's what you use. The nurse should know that's what you use. The medical assistant should know that's what you've used. And then also being able to clearly articulate the role, what you did, to outcomes. This impacted the health of this person. This meant the person didn't go back to the emergency department. And this is why there should be billable codes. This is why we should be included in the Social Security Act as providers, along with psychologists and psychiatrists. So I think it's about really being clear about what we do and who we are, because there's an article that just came out in a British journal. The title was Social Workers, Jack of All Trades, Master of None, which, like, if that means nobody knows what we do. So we have to be responsible for clearly articulating. And I keep learning that more and more as I do research. We're doing it much better than 20 years ago. But
it's maybe it's the double-edged sword of having a profession that is so broad and that is involved in so many different areas of social life in our communities, that critique is very easily levied at social work. And you know, it's just disappointing to hear, but also should wake us up a little bit to the need to market ourselves and articulate, as you put it.
Yes, and marketing is very important.
How about you, Wonhyung?
Well, I mean, I was just saying along everything that just said, because I cannot just agree more to what has been said about our role and also what's the message. I mean, over the pandemic, you know, whenever there's a discussion about essential workers, I think, you know, in the media, automatically, right, the settings or people who are being interviewed are in gowns. And I think just public image or perception of medical workers or essential workers are very place bound, right? I mean, it could be nursing homes, it could be grocery stores, however we define it. But because social workers are everywhere, sometimes I think that ubiquity could work against us, I think. And also I think social workers are, I don't know if it's like a temperament thing or or maybe just, you know, want to go home and rest. But I think sometimes we really want to push ourselves to be out there more and talk about what we do. I think it's a challenging one. I mean, I'm glad that there's a campaign about, social workers are essential, but at the same time, it's telling us that we have a long way to go. The fact that there's this campaign, I think we have a long way to go.
Yeah.
Well, and I like how you just mentioned that, because we are in different settings. I mean, my past jobs, I was the only social worker when I worked in the school. But when we think schools, we think teachers. We don't think about the social work. When we think hospitals, we don't think about the medical social workers. We think about the doctors and the nurses. And that just continues to go on. And it's how do we raise our voice and share our experiences when we're sometimes in settings and environments where we are like the only one there, or a very small team of social workers, and we're not really what they think about when they think about the setting. So that's something that hopefully we can all continue to share our voices about our experiences in different types of settings and environments.
Yeah, and for me, I guess I would say, there's so many things that I could say are relevant to social work and social workers, but I'll just pick a couple. The first for the veteran community is the importance of social workers and social work agencies and programs where social work is happening to really educate themselves and learn about military culture and about veteran culture. One of the things that has really surprised me and has really become incredibly significant in my research, our research, is really thinking about, what it means to be a veteran, what it means to be a military service member. And there's a whole culture around that, a whole set of discourse and beliefs and values and approaches to the world that are not necessarily always understood by civilians. And so the idea that civilians would be providing services to veterans, whether it's healthcare services, mental health services, behavioral health services, any of those services, without fully understanding the role of that veteran culture and military culture, I think that's a missing piece. And so I think social workers, again, in this notion of being boundary spanners, can be really critical in helping programs and helping agencies and institutions be more educated about veterans, be more sensitive to the veteran community and their needs, and then similarly doing some education the other way. So there's this, again, boundary spanning feature where social workers can help both sides through their educational role. That's one piece. I guess the other piece I would mention, and it's somewhat related, but not to do with veterans as much, but is really about my work in peer support, which is that this notion, one of the notions of peer support is what I would call someone who is a peer, who has that definition of having the shared lived experience with someone else, is what I would call an expert by experience. So that's someone who has expertise that's not necessarily academic expertise or, societally sanctioned expertise, but it's the expertise of having the lived experience, whether that's going through an addiction, whether that's being deployed and being in the military, whether that is having a psychiatric disability, whether that's being, an immigrant in the US. No matter what that is, that experience, that lived experience gives that person a set of expertise that others do not have. And so I think social workers have a responsibility to really honor that experience or expertise by experience, and sort of trying to incorporate. So it means things like trying to incorporate client voice into agency services and trying to say, hey, if we're a homeless shelter and we're serving homeless individuals, are we also including those people in policy decisions? Are we, asking them what the experience is like for them? Are we trying to fully understand and include them in our own processes, organizational processes, planning processes? And sort of, really approaching whatever situation someone might be in, approaching it as a source of expertise and partnership. So I think social workers can advocate for that. And that's part of peer support, I think, for me at least. Is advocating for people to have more of a voice, and maybe it even relates to the political situation currently too. That we're starting to see communities, as Vicky said, get more civically engaged. Hopefully, we're starting to see people take a voice in politics and starting to whether that means going to a rally, whether that means going to a march, whether that means getting involved where before you weren't involved. It's about saying that everybody should have a voice, should be at the table. And I think social workers play a key role in that.
Well, I want to thank you because all of you coming on this podcast today is a way to share that expertise and get that information out to individuals. So I want to thank you for really being active this work month in helping to continue to get your voice out there and share your expertise. So thank you so much for being on the special Social Work Month edition of the Social Workers.
And I would just make a quick plug too. We have a great School of Social Welfare here at the University of Albany. And if you're listening in the community, this show is called The Social Workers, and it airs weekly on WCDB Albany. And our school is, I think, a really valuable resource to the community, a valuable resource to the university community, but also to the larger community around the state and certainly in the capital region. And so if you know folks that are interested in social work and they want to check out our program, our master's program, our PhD program, any of our educational programs, certainly check us out, look at our website, find out more about the School of Social Welfare. It's an exciting place, a lot of exciting research happening, a lot of exciting teaching happening, policy work, all sorts of things are going on at the school. And I just want to kind of put in a plug for that too.
And if you already have your degree, whether it's a social work degree or a LMHC or a psychologist or just a profession who wants to learn more, we also have a continuing education program, and we have so many different presenters, especially in this pandemic year. A lot of our workshops actually all our workshops are via Zoom. So we have presenters now from California and Oregon and just different parts of the country sharing their expertise. And we're able to sit for a 3-hour or 4-hour workshop and learn and enhance our skills and knowledge. So to find out more about our continuing ed program and all of the workshops that we have, visit our website at www.albany.edu/SSW. And the same goes if you're interested in being a student in our program.
And I guess this would be a good time to again remind listeners about the Katherine Breyer Lawson lecture. Do you want to give that information again, Alyssa?
Yes, and again, that is free, open to the community, so anyone can attend. And it will be on Friday, March 19th. You do need to register so you can get the Zoom link. And the title of that workshop is White Supremacy, Psychological and Social Impacts in the U.S., and that will be a lunchtime workshop. It's from 12 to 1:15 p.m. So you can, if you're at work, you can just log on to Zoom, have a little, lunch and learn, and get back to your day. But I think it will be very informative and a great way to, I think it's a great topic right now, and especially during Social Work Month.
So if you've just tuned in, you've been listening to the Social Workers here on WCDB Albany. I am Eric Hardiman, and I'm here with Alyssa Lotmore, and we've had a virtual panel with Dr. Wonhyung Lee and Dr. Victoria Rizzo from the School of Social Welfare, and it's been really exciting. We have lots of great shows lined up on the social workers. We have an upcoming show that is about a new community development project in Albany that involves skateboarding for youth. We've got all sorts of, great interviews lined up. And so we hope if you've just tuned in for the first time that you'll keep listening and keep checking us out on Twitter and all of the other social media avenues that Alyssa helps us connect with. And Vicki and Wonhyung, thank you so much for joining us today.
Thank you for having us.
And we hope you'll come back too.
Well, you know, I'll find you.
Definitely.
I always email, and I'll send a lot of emails saying, please come on again. So hopefully, thank you again for coming on, and hopefully you'll continue to, you know, answer my emails as I say, please.
So thanks for listening. We will see you on the next episode here on The Social Workers, WCDB Albany.
You're listening to The Social Workers on WCDB Albany.